Hello friends, myself Poornima Kabadagi from College of Agriculture Vijaypura, University of Agriculture Science Dharwad. I am gonna talk about common terminologies and instruments used in veterinary science. This topic is allotted by my course teacher S.Y. Mukartal sir, Assistant Professor and Head, Department of Animal Science. Antigen, any foreign substance with a high molecular weight which incites formation of antibodies in situ is called as antigen. Examples are toxin, bacteria, virus cells. Antibody, a substance in the blood, serum or other body fluids formed to exert a specific restrictive or a destructive action on bacteria or other antigens, and it is foreign or heterologous protein substance. Their production is stimulated by entry of antigens in the body. Epidemiology, it is a study of disease outbreaks with an effort to trace down the original inciting cause. Immunity, it is a power to resist infection. There are two types of immunity, active immunity and a passive immunity. Active immunity is developed in the host itself, and passive immunity acquired by injection of antibodies. Active immunity develops in 2 to 3 weeks and passive immunity develops immediately. Active immunity lasts for a longer period, passive immunity lasts for a shorter period. Active immunity is used for a prophylactic purpose and passive immunity is used for both therapeutic and prophylactic purposes. In active immunity, there are natural and artificial. Natural is like animals recovered from disease, and artificial is vaccinated against foot and mouth disease. In passive immunity, whereas natural is like a cough on colostrums and artificial is anti-snake venom serum or anti-tetanus serum. Symptom is any departure or deviation from a normal function, appearance, sensation experienced by the patient is called as a symptom. Like we can see when various symptoms in animals like vomiting, diarrhea, itching, skin irritation, change in appetite or a loss of appetite. These are all some symptoms of a disease. Clinical signs are those abnormality indicative of a disease discoverable by the veterinarian at the time of the examination of the patient is called as a clinical sign. Serum. Serum is a clear or amber colored fluid which separates from blood when clotting occurs and is rich in antibodies. And it is serum will not be having red blood cells or platelets or white cells. Etiology. Etiology is a causative agent of a disease. What is virulence? Virulence is a degree of ability of organisms to produce infection. Attenuation. It is a reduction in the virulence of a living organism by passage through series of animals, like in vaccines. Quarantine is animals are detained at frontiers or parts of entrance areas or at other official centers for a period of isolation before allowed to mix with the stock of the country. That is called quarantine, as we have seen in coronavirus. Vaccine. Vaccine is a suspension of killed microorganisms for the prevention of infectious diseases by introduction of with a less virulent organism. Zoonosis. Zoonosis is a disease communicable between animals and men. And some formulas are there like morbidity rate, mortality and a case fatality rate. Morbidity rate is a percentage of animals manifesting the disease to the number of animals at risk, and mortality rate is number of animals dying of the disease to the number of animals at risk, and case fatality rate is a percentage of number of animals dying of the disease to the number of animals manifesting the disease. Vector is nothing but the carrier of an infectious agent. Disease transmission, it is a spread of a disease. Carrier, any animal that harbors the organisms without showing the clinical manifestations of a disease and transmitting these to healthy organisms. Like vectors and carrier are different. Some of the vectors are sandflies, ticks, midges, mosquitoes. What is incubation period? Incubation period is a period of entry of organism into the body and showing of symptoms of the disease. Prognosis. Prognosis is different from diagnosis. Diagnosis is detecting which the disease is, and prognosis is forecast of a probable outcome and course of disease, particularly with regard to early or a late recovery. Bacteremia is presence of bacteria in the blood. Viremia is a presence of virus in the blood. Toxemia is presence of toxins in the blood. What is septicemia? Septicemia is both bacteremia plus toxemia. There are some classifications of diseases. first one is according to duration and severity. There are four: per acute, acute, subacute, chronic. Per acute, it is for a very short course like few to 48 hours and is very severe symptoms. Sometimes no symptoms and animal will die suddenly. For example, anthrax. Acute, by a sudden onset, it will be having short course like 3 to 14 days and severe symptoms. Subacute disease, course is of 2 to 4 weeks, severity is less than the acute one, and examples are foot and mouth disease, subacute mastitis. Chronic course is more than 4 weeks and signs are not severe in character. Example is tuberculosis. According to area of spread: sporadic, endemic, epidemic, pandemic, and zoonotic. Sporadic, that shows a little or no tendency to spread within the herd. Example, zones disease. Endemic is a disease, that outbreak of a disease among animals in a definite area like anthrax and HS. Hemorrhagic septicemia. Epidemic, affect large population of animals in a large area at the same time and spread with a rapidity. You can see here endemic, epidemic, pandemic disease, that is very spreads very rapidly. Pandemic, widespread, usually of a worldwide distribution. Example, influenza virus, fowl influenza. Zoonotic is transmitted from animals to humans or vice versa. Example, brucellosis, rabies. Next classification is according to mode of spread: contagious and non-contagious. Contagious are those diseases which spread by means of direct or indirect contact with the diseased animal. Example, hemorrhagic septicemia and foot-mouth disease. Non-contagious diseases are those that do not spread by means of direct or indirect contact. Example, rickets, milk fever. Next, according to causes: specific disease, non-specific disease. In specific diseases are those that are caused or produced by a specific pathogen, and in that too, infectious, non-infectious. Infectious are pathogenic organisms. Non-infectious diseases caused by physical, chemical, or nutritional deficiency. Non-specific diseases are those that which have a indefinite causes. Next classification is according to mode of origin: hereditary, congenital, acquired. Hereditary is transmitted from parents to offspring, and congenital, acquired during intrauterine life, and acquired after birth. Hereditary, from parents to child. Some of the instruments and materials used in animal health care are travis, that is used to control the animal during vaccination or medication or milking, and stethoscope, clinical thermometer to check the temperature of the animal, bodies of castrator to remove the testicles from the male organism, electric dehorner to remove the horns, mouth gag while use application of medications, liquid, tooth rasper to sharpen the sharp tooths, molar tooth cutter to cut the teeth of a animal, and metallic horn cap, pestle and mortar, rubber floor mats. AI gun, artificial gun used in artificial insemination. Sheath and semen straw. Dystocia kit is used during pregnancy when parturition is very difficult. Hernia clamp, vaginal prolapse clamp, chital forceps. Some of the surgical instruments used in veterinary are like BP blade, scissors, maybe curved or straight, thumb forceps, Alis tissue forceps, artery forceps. You'll get curved and straight both. Needle holder, suturing needles, SS tray, reed siphon. Thank you.